and welcome to another episode of Going All In, Get the Edge You Need to Succeed. I'm Dr. Erin McKinley, and today we have another awesome spotlight session with Kathleen Carozza from the St. Elizabeth University Combined Masters in Nutrition and Dietetic Internship based in Morristown, New Jersey. All right, welcome, Kathleen. Welcome to the podcast. To get us started for this episode, give us a little introduction to you, your journey to RD, and how you landed at St. Elizabeth University.
Sure. So I have been an RD for more than 30 years, probably well before many of the people listening to this podcast were even born. And I went through a very traditional route to become a registered dietitian. I did my undergraduate at Montclair State in New Jersey, which is where I grew up and where I still live. And I did do my dietetic internship in Peoria, Illinois. And then I came back and did a master's degree at New York University. And when I was in my internship, one of the great things about an internship is that you do get to see all different aspects of the field. And I learned very quickly that I liked numbers. So I liked nutrition support. And I also liked management. And when I came home, my first job was in school nutrition. And at one point, I was in management in a healthcare situation. And then we had some things happen in my family. I had some health issues. We had young children. And I said, you know, it's really hard to balance all of this and stay healthy and manage my own family as well as my health issues. So I stopped working full time, but I started adjuncting, and I ran into a current colleague at a Starbucks. And, you know, that networking, it takes you far. So we were chatting, and I was telling her that I was teaching in another institution in their hospitality management program. And she said, oh, send a resume over. So for sure I did. And lo and behold, within a year of adjuncting, she had a part-time position, which was the perfect balance for me. I had young children, and I got to work 10 months part-time with dietetic interns. I felt like I was really in heaven, because when I left college and left my internship, I just kept thinking, I would love to do this someday. And I think when I left college, I was thinking, I don't know if I really want to leave college. So some of the students may be feeling like that as well. And after a few years, we had a faculty retire, and my predecessor as the dietetic internship director had decided she wanted to move into a regular faculty position teaching and managing the DPD program. And I was hired as the DI director. And so I have been with the college now for 24 years, and I'm actually getting ready to retire. So excitingly, we have a new director hired, and she has some experience running a DTR program, and she's incredibly enthusiastic. And I know that my legacy is going to move to the next level under her leadership when she takes the program over, which is really exciting, because you do feel as an internship director like this is your baby. And I often feel like the mother hen of the group, for sure. So that's kind of how I got here. And what I'm going to be doing when I retire, aside from probably a lot of volunteer work, my heart is definitely in addressing food insecurity issues and community gardening. But I also run a food culinary tour on the side in the same town where the university is. And so I'm going to be doing that. And I was inspired to start that business by another faculty who did a presentation at Fancy a few years ago, having retired and done a similar thing. So there's lots of exciting opportunities in the field.
That sounds amazing. So I'm going to let you take it away and
Sure.
tell us all about your program.
Sure. So we are a combined internship, master's and internship. We have two concentrations. You'll see here, entrepreneurial nutrition practice, which I'll tell you more about, and community and public health nutrition. And of course, our mission is to prepare you to be entry level. But one of the aspects that ties in the university mission is a focus on leaderships and service, as well as, of course, ethical practice. And then, of course, our goals are related to that mission to really prepare you for professional practice within our concentrations. We have 32 positions, and we do have a pre-select option in our program. So some of our undergraduates match to us, and we have, because of that, 13 for the April 21 match for our entrepreneurial concentration, and we have 16 for our community concentration. And I will tell you a little bit more about that as well. So the entrepreneurial concentration starts the program in August. So if you're matched in April, you start in August and you do a traditional academic year of courses, a summer with a 2-credit course, and then the second year you're doing supervised practice. One of the great things about having our master's separate from our supervised practice in a combined program versus a coordinated program is that you can live wherever you want to live. All the coursework is online. The community and public health concentration starts in January. So if you're a student who doesn't get matched in April, second round match, you could look at, and then also fall match. So we do match 2 different times for this January start. We match in April, and then the positions we don't fill, we will match in November. And that program starts with a traditional academic semester, a 2-credit summer course. So all of our 32 interns are in that same course in multiple sections in the summer, another semester of traditional coursework in the fall, and then they start supervised practice in January and finish in August. So the entrepreneurial is a May finish, and the community is an August finish. And that kind of ties into how we do our clinical, which I'll tell you about. So our master's program coursework is really geared to take you to the next level of preparation with a focus on current issues, health promotion, research and weight management, and counseling skills, as well as a course that has an integrated component in the community where you do a community needs assessment and implement a community program, which the hours for that part count toward your supervised practice. And the core courses really build that understanding of metabolism as well as general healthcare research. And of course, we keep going back to that focus on ethical evidence-based practice. Our online courses that first year are flexible. Most of them are asynchronous. And for the students who've survived through COVID, they're much more used to online learning now. So it's a little bit less of a transition than I think in the past for these students. So that's kind of exciting because I feel like students are going to feel a little more comfortable with this format of learning. Our department chair and grad program director is certified in a program called Quality Matters, which is a peer evaluation program that looks at coursework online to make sure that it's really scheduled, that it's really developed with the student learning in mind. And so there's weekly participation and interaction. And there are a couple of classes where there's also a few in real-time Zoom-based meetings. So while most of it is asynchronous, there are a few classes and a few times where you meet via Zoom together. The coursework does take 30 to 40 hours a week to complete, but we find that most students can balance working a part-time job with that because there is no commuting, and because most of the coursework can be done at a time that works for them. The courses in the master's, the whole program is 38 credits, and 20 of the credits are master's traditional coursework. 18 credits are in the internship, but 10 credits transfer back to allow you to complete the 30 credit master's, which is the minimum requirement of credits for a master's in New Jersey. So the courses are outlined here. There's a health promotion, weight management, metabolism, research, the course I was telling you about with the community, and then the child and adolescent nutrition course that's taken in the summer. That course does have a focus more on child, not as much, a little bit of normal nutrition, but also on different illnesses and conditions that a child may have that also start to introduce the nutrition care process again, because that's something that, students kind of have as undergrads in their medical nutrition therapy or in their verification coursework. And so then that gets reintroduced at this course specifically. It also gets introduced, the nutrition care process, in the community course to look at the nutrition care process from a community standpoint. Within the coursework, the two concentrations are pretty much the same except for the one elective. The community and public health students take a public health nutrition course, whereas the entrepreneurial students have a choice of either an integrative nutrition and health therapies course or a sports nutrition course. So depending on what their interest is. And as I mentioned, a variety of different aspects are built into the course. Their quality matters reviewed. And they really do emphasize a lot of new research, integrating websites and social media and tools so that you're really prepared. And one of the things that we do ask our students upon completion of the program is how they felt about the master's coursework and whether they feel like it was helpful to them in their supervised practice. And the majority of our students say, like over 90%, that they really did feel that they could benefit from those courses in their interactions and in their supervised practice. They also say that they do feel that we're a good value for the cost, because as a small private institution with a combined program, we are definitely on the higher end for some people than other programs. But that always makes me feel good, especially as a parent of recently graduated college students, making people feel like they are getting their money's worth, because we want to challenge students, but we also treat our students as our customers as well as our future colleagues. I mentioned a little bit more that, we do obviously focus on ethical evidence-based information. We do have those few web time interactions or web conferencing for real-time interactions, but also all of the services that a student would have on campus, a student will also be able to access online. So everything from support services through advising and counseling and the help desk are available to students. The faculty who teach in the master's coursework do an orientation to Moodle. Although most students have used some form of online classroom, not everyone's used Moodle. So they just kind of introduce how we use it and what our courses are, how our courses are set up. And again, weekly participation is expected. So students are not just, the course is not just thrown up on Moodle and you do it whenever you want. There are milestones, which I think helps keep students organized and focused in the coursework. For the dietetic internship coursework, we have about a third of the program, which is kind of reflected in the number of credits in clinical. So 7 of the 14 core credits are in clinical. So we do provide a solid foundation in clinical, but then we offer some additional traditional components like management and the community. And we try to infuse additional professional skills. So in addition to a 2-week final rotation, we do introduce a lot of social media, public relations, and nutrition communications. We have a capstone course, which is basically compiling all the work you've done and doing some self-reflection, but it also includes a 2-day review course. We're using Sage Nutrition, and that's new for us this year. And then each concentration has a focus course. I like to show pictures of the students because I think that makes you feel as much as possible that we really do feel like we're a family, and the institution is small, and although our class is a decent size, it's not a huge, overwhelming class because they are broken into 2 classes of 16, and students do a lot of work in small cohorts. So we have a different kind of a clinical model, which I'll talk about, but in the picture on the top to my right, you'll see the students that are taking a selfie, and you can see that some of them are looking and some of them are looking the other way. And the person all the way in the back is our clinical faculty. And then we have 5 students in this cohort. On the top, we have a picture of students at a professional meeting, and then a class celebration luncheon we had, and graduation, and some activities in our foods lab, which we certainly hope to get back to post-COVID. Things have changed a little. For the internship part of the program, we do provide some additional pre-program preparation that's totally outside of the master's coursework. And then we have some orientations that are required and a part of getting ready. So an orientation that goes over all the medical things you need to do, and the background checks and the drug screens and all of those things. An orientation that is the first week of the program, and a clinical orientation. So I mentioned we do have a clinical faculty model, and that's definitely something that we feel is a strength of the program. One of the things I'm really proud about as we've developed our program over the last years that I've been the director for the last 14 years, we really take a hard look at things that students tell us every year, and we really do make changes based on that. And I think that's like a perfect example of quality management and performance improvement, just always taking a look at what is happening and what are the trends. And one of the trends we saw in our area in New Jersey is that it was really getting harder and harder and harder to find clinical placements for students, because there were so many internships and so many students and distance programs. And we felt that that was getting to be a challenge. And I found out about another, I guess it was 2 different sites, one in New York and one in, I think, Georgia, that were doing this clinical faculty situation. And so we've kind of developed it in our own way. So we have 2 full-time registered dietitians with master's degrees and about 10 years experience plus each. And we work with Atlantic Health System, which is a large medical system in northern New Jersey. They have 2 large teaching hospitals that are only 8 miles from each other. And one is only a mile from the college, and the other's only, 7 or 8 miles from the college or university. We became a university in July, so I apologize if I slip back to college sometimes. So these faculty work with small groups of students. So 4 students at a time are working with that clinical faculty doing their training. And so there's a lot of one-on-one attention, because while the faculty has charting rights and can sign off on the students' notes, that faculty doesn't have a traditional caseload like the rest of the dietitians. The dietitians like it because occasionally they take a student with them who's either doing really well or who might need some one-on-one attention. So they do get to still interact with students, but they also have the benefit of not having that responsibility every single day, which is a stress because the dietitians are seeing more and more patients. And in the last few years, they're doing more and more nutrition focused physical exams and order writing. And so that was a big deal in New Jersey when our hospitals and our dietitians were able to start writing their own orders and changing diet orders. So those responsibilities took their workload up a level, which also meant that it was harder for them to do the volunteer training, volunteer precepting. And there are great many of volunteer preceptors, but for us, we really felt this was going to be a great model. And so far, this is our 3rd year, and so far, so good. We've definitely, the first year is always a little harder, but we've learned a lot along the way, and we've made some adjustments. And right now, we think we're in a pretty good groove with it. So we're really happy with it. The other thing that we do have is a very structured curriculum. Every single unit is set up the same way with your goals and objectives, and then your learning activities. So that's kind of what am I actually doing when I get to the site. Many of our rotations, you're with at least one other student. And then in the clinical acute care, you're with 3 other students. And there's a couple rotations where you are on your own. And those rotations are all planned and scheduled by the faculty. The only one that students kind of select on their own is for that community class I mentioned in the first part of the program. And then toward the end of the program, students have input as to what they would like to do for a final experience. I did say this, but the other part of this, having this curriculum set out, is we also have a very strong, we have 4.5 FTEs. So 4.5 FTEs for 32 students is a pretty good student faculty ratio for an internship. And so we have 5 major rotation areas: the clinical, the management, the community, the professional development, and then your concentration. And each of those areas has a faculty point person. So as a student, I always know who I should ask a question to and who's going to be looking at my work. And one of the things we like about having faculty review student work is there's a lot of consistency with the feedback. And we also, as faculty, talk about the students and how their growth is. So we get to see and really help the student with that professional growth during the program. I always love to show pictures of the students. So here's a few more pictures of the students. Again, graduation. This was graduation a few years ago, and the student in the middle on the bottom here is now one of the preceptors, which is what happens all the time. And that is really a fun thing when you get to have former students who are preceptors. The Foods Lab picture to the right, where it looks like a food demo, that's also an alum and a current student, but they also worked together at one of the cooking schools in the area. So that was fun. And then, of course, graduation. This was our very first graduation with the combined masters. And that's up at the top. And I said to the students that year, my daughter was graduating college, and I was like, you have no idea how hard it is for me to not be able to be at this graduation, because it was the first one with the masters. But of course, I was at my daughter's. These are how our hours are split up. And these are pictures of students at Fancy when it was in Philadelphia, which is not too far from us. It feels like it was ages ago, but it was only last year in 2019. So I mentioned the clinical faculty model. There's 8 weeks of clinical training in the hospital, a little more than that. And then there's a week of an outpatient experience and a week of extended care. And students can give us some input on the type of place they'd like to be for that. The management rotation is 6 weeks, and it focuses on all the basics of management. Typically, students are with a partner, and these are pictures of students doing their theme day event. The majority of the work in the management is on projects. So the students do an in-service and a theme day and a business plan and a performance improvement. Pretty typical. But one of the reasons we renamed the the rotation departmental management is that we really like to emphasize to students that the management skills they're learning in food service relate to other areas of practice. And that, to me, is really important for students to recognize the transferable skills they're gaining in different rotations. We have a community service project. Those are usually team-led projects. This is the hours that they do in that community course, community nutrition ed. And then we have some other simulated activities and field trips in the community. And more pictures of the groups, the full class pictures and students at their sites, and the one with the mask, they were working last summer in a food bank during COVID. For our professional development rotations, students do an evidence analysis investigation together. They have training in motivational interviewing, and they pick a 2-week final experience. And then we also have an emphasis on participating in advocacy with public policy assignments. And we have an alum who works for a communications firm, and we do a project with her on social media and culinary skills as well, which is a lot of fun. And that we usually do like the last day of, part of that we usually do the last day of orientation. So it's kind of a fun team building day as well. The concentration. So our entrepreneurial concentration has been around for a while now, and that one is at a supermarket. Our supermarket in this area, ShopRite, is the most popular one, and they have a lot of store dietitians. And then we have 5 weeks where students are going 3 days a week. 1 day a week is motivational interviewing training and nutrition counseling training, and 3 days a week they're placed at a variety of different wellness corporate wellness or campus wellness programs to be able to do nutrition counseling. So they do tabling events and one-on-one counseling. And then for the community and public health concentration, this has evolved because it's our 3rd year, and 2 of those years were COVID impacted years. But generally that focus is on agriculture and federal programs and kind of the interaction between the two. Some pictures of that. The center one is at a local community garden, and then doing some community service projects and at professional meetings and in the supermarket. So obviously you need your DPD verification. We're not a future model. We are not a coordinated, we are combined. So you do have to have a bachelor's degree finished before you start with us, and a DPD verification done by the time you start with us. We don't require GREs, and you don't apply separately to the masters. So you apply through D&D, through DICAST. We do publish our name if we have openings for second round. And although I know it can be very competitive depending on what part of the country you're in, the numbers of applicants have been going down and the number of internship sites have been going up. So that puts you all in a very good position right now if you're willing to look maybe outside your current thoughts about where you'd like to go. We do have a selection committee. We look for a minimum of a 3.0. That's a little bit of a hard, fast rule for us because we have found that if we accept students with lower than a 3.0, the university requires a 3.0 to graduate with a master's. And so that has become a challenge in the last couple of years for students who didn't meet that 3.0. Sometimes we have student with a 2.9. That being said, we do look at if you're a second degree student and a first degree was a lower GPA, and the second degree in nutrition is a little different. We weigh people's work experience. One observation I have from interviews this year, very hard for students to get experience during COVID. That's okay. You're going to get a lot of experience in the internship, and you're all on the same playing field. So no one should feel badly about that. Living through COVID is experience enough. And we do a personal interview. We do ask, obviously, look at your narrative. We have a 100-point scale, and most of the points, 40 of the points are your GPA, and we look at overall GPA. And then pretty much everything else is 15 points each. We do give a few points for speaking another language, and so that is combined with work experience. And with work experience, we also look at your volunteerism and other things that you've done, not just paid work. So it's great if for people who are juniors starting to look at these podcasts, awesome job. And for others, it's been a rough year. So if you're not exactly sure what you're doing, think about it. You have time. When I finished my undergraduate, I still had like 2 classes to finish for what was then called a Plan 4, now the DPD verification. And I wasn't sure what I wanted to do. So I worked for a year and did those classes and started, doing some other things. And then I applied and got in. So, take your time, make sure it's a good fit for you. Consider talking to other graduates of the program that come from your university. I'm always happy to match students up if I've had a student from your undergraduate experience as well. And then make sure you check your narrative, follow all the instructions, know the program codes, apply for loans, apply for grants from the foundation. And remember, when you fill out the FAFSA, you're no longer on anybody else's, you no longer have to report anybody else's income. The awards for loans for graduate school are all based on your own income, but definitely look at the Academy Foundation scholarships. I was on the committee for several years, and there are sometimes scholarships that go ungiven because the donor has very specific criteria. And if you don't indicate that criteria and answer every single question, then the committee has no way of knowing that you're somebody who might have met that criteria. So I definitely encourage that. And look into some other. Diversity Dietetics just put out a great, they're looking at really providing some grants. We've had students get grants from the Hospital Association in our state. So look for other things that might fit. Our students are out there doing everything that you can think of in the field. Any kind of clinical specialty, management, corporate wellness, their own private practice, pharmaceutical and regulatory. We have people working in food insecurity programs, both in large food banks as well as food pantries, as well as in a lot of different federal programs, and some students who have gone on to do more research. And actually, it's really fun because I have two alums, one who's a faculty at Rutgers and one who's a faculty with us now. So that's always fun to see. The frequently asked questions, I'll go through these really quickly. Do students need to relocate? Not really. Students can commute if they're willing to. Sometimes students will relocate just for the clinical because that's in one concise area, and they might live in another area and we can place them for other rotations closer to that. So that kind of also addresses commuting. In New Jersey, we look at 45 minutes to an hour to being kind of a normal commute. So that's kind of what we would anticipate for most rotations. And then there's always additional work. So we do tell students, when you get home at night, you're probably going to have something else to do or look up. I talked about the 3.0. And as I mentioned, during the first year, we do find students are able to work, 15, 20 hours a week. For the internship, we do have students who need to work, even if it's just for gas money. And that's usually like one weekend a month, or every Saturday, or every Sunday, or every other weekend, that kind of thing. A job that maybe they're used to doing in a diet office, or maybe something like bartending or a waitress, food service. Or even childcare. So something where you can get a little bit of money, but not too much stress. You have enough stress when you're going through the program. The program in total is about $40,000 for the master's and the internship. So it is spread out over the semesters that you're taking the courses, and you're paying as you go. I mentioned about the practice sites. We do arrange the practice sites. We do look at where you live. And in some instances, you have some options of picking the type of environment you'd like to be in. And in addition to the type of environment, you can always say closest to my home, and we'll try to accommodate. Students are evaluated all the time. There's informal, constant daily evaluation with the people you're working with. And then there's formal evaluations at the end of each unit, at the end of the management rotation, at the end of the clinical rotation. And we have a mid-program professional evaluation where we talk more about general professionalism and professional skills, and also about where you think you want to go in the field, so that we can help facilitate that for your final rotation. We do sometimes have students who need extra time, and we are able to do that. We are able to either provide them with additional time in the hospitals or do some other practice with a faculty one-on-one. And the students are doing well on the RD exam. The first year pass rate is in the 90%. We did add the RD review exam prep, which we feel is really going to strengthen that as well and be helpful for students. Of course, with COVID, it's been hard for students to find jobs, but not impossible. A lot of our students are currently working who just finished and just passed the test, because we did have a group that had to delay finishing till October. And we have a group that will be finishing in May. But we are always getting, New Jersey is a small state, lots of people know each other. So there's always people who are contacting us for our grads, which is great. So that's our program. I really hope you'll think about us. And if you aren't matched in your first round and you haven't thought about us and this piques your interest, reach out to me. and you can find more information. One thing I will tell you is when students go to our website, they do tell me there's a lot of information. So that can be good and sometimes overwhelming, but some of it's in bites. So there's information about the practice hours, information about how to apply and how to get a hold of us. One of the students did a cute little Powtoons for us that just kind of walks you through a day in the life of, and you can definitely find out more if you want to come to New Jersey.
All right. That was extremely informative. I love it. I think your frequently asked questions hit all of my backup questions.
Oh, good.
I'm going to jump right into the 5 questions that I ask all programs that come on the podcast. And these questions were put together with the help of my students.
Great.
These are the things that they just like to know from directors. So the first question is, what is one thing in particular that you love to see, or you know that the application review committee loves to see when they're reading a personal statement?
When they're reading a personal statement, stories that, and I say stories, right? Because we all know that actually people follow stories more than they follow advice. If it's taught to them sometimes in a story, they're going to follow it. I think stories that connect why you think our program is a good fit for you really highlights that the committee really likes to know that you've thought about what that would look like for you. And stories that kind of give us a picture of what you're like as a person. And of course, that answer the actual questions that were asked. we do kind of get a stickler on making sure that you've gone through the questions that were asked.
All right. This second question is a true or false question.
True
or false, an applicant's resume should always be 1 page and 1 page only. Either way, why?
I think that's a little dated. I'd want to be able to read what the person said, and I'd rather see it, especially if they've had some significant experiences. And for me, we use that a lot to help us evaluate the points that we give for work. So it really helps me. So, I know there's a lot of talk about keeping a resume 1 page when you don't have a lot of experience. I will say that when students finish the program, they need to think about making sure that their resume reflects what they achieved in the internship. Sometimes I'll see students hand in a resume at the end and I'm like, wait a minute, you just spent a year with us and you've got this much about that year and this much about what you did in high school. So I think students can be careful not to put too many things, but it is, for me, a resume 1 to 1.5 to 2 pages, not a problem.
I think that's pretty good advice. All right. So what is one thing that an applicant may do, and this could be in any interaction that you have with them prior to the applications being sent in, or when you're reviewing the application, and you mentioned during the interview process, something that raises a red flag to you where you think maybe this person isn't the best fit for this program?
So, directors are managing, just like everyone, a lot of things. And so what really gets under my skin and gives me a little bit of a trouble is if a student seems very insistent on me doing something immediately. So lack of kind of respect for what else a person might be doing, and also for our process. So we don't require a portfolio. We will look at it, but because we don't require it, we may not get to look at it before we meet, or we may not get to look at it right away. And one time I had a student who was insistent that I had to get this portfolio seen. And then when she finally got it to me, I couldn't open it. And then when I finally could open it, I thought, you should have never told me to look at this. It was not professional or appropriate. So I thought, you just kind of sunk yourself. So I definitely think kind of as much as this is what I kind of tell students about supervised practice, this is new and exciting for you, but this is the other person's job. And so when a person has a job, they're balancing multiple things, and they're not ignoring you, but they may not get back to you. And I mean, I get back to people usually within minutes, if not 12 hours at the most. But sometimes a student is like, I haven't heard about this yet. And it's like, okay, well, I haven't gotten there yet, but I will. Don't worry. We're going to make sure you have the Zoom link for the interview. So I think that can be challenging. And I know it's hard for students because they're excited and they're anxious, and the process is nerve-wracking.
All right. So even though you're retiring and passing the baton to the new director, is there anything that you're still actively working on trying to make even better of an experience for the interns?
Yes. So as a matter of fact, the thought about clinical. So when we had my first site visit as a director, I was very proud to hear from Elaine at the time, who had been very active in CDR, and was one of my site visitors, that she was really appreciative of the way that we were constantly improving, which I had mentioned, so that we really do like to take student feedback. And one of our observations right now with our clinical faculty model, we have the 2 hospitals, we have the students, and we've been placing them kind of based on where they live, although the hospitals are very close to each other. But one hospital is a little bigger, is a trauma center, and has a very strong cardiology department, and they're the same healthcare system. The other one is really known for neurology. So we've been thinking about sometimes when students are chatting with each other, they're comparing notes. And whenever you're comparing notes, you can get the sense of the grass is greener on the other side, whether it is or not, you can get that feeling. So we've been debating, and I think we're going to move forward with a plan for next year's schedule, because I will do that before I leave, with having students split their time so that out of their 4 weeks of med surg, they'll do 2 at each hospital, and out of their 4 weeks of nutrition support, they'll do 2 at each hospital, which also allows them to get 2 different clinical faculty, because that's the other thing, is all of us click with different people differently. So sometimes just learning from someone else or seeing someone else's style is helpful. So that's one thing that I think we are going to be doing. And I will say, Teresa has been a trooper. She and I are meeting once a week, even though she's not starting till May, and we're just kind of hashing through the program and how things work. And I've known her for a long time through the Dietetic Association. So I know she's going to do a great job.
All right. Well, my last question of the 5 is a 2-part question.
Mm-hmm.
The first part is, what are the best or 3 best adjectives, descriptors, or phrases you feel best describes the program overall?
Comprehensive. I think focused on the individual. That's very important to me, that all students in the program could see themselves in a mentor within the program, whether it's a faculty or a preceptor, and that we help students find their best selves, because everybody shines in a different way, but everybody has a light that can shine. And so for me, that's really important.
All right. So the second half is very similar. 3 adjectives to describe your ideal applicant.
Oh, intellectually curious, enthusiastic, and thoughtful.
All right. That sounds good. Well, you definitely answered my entire list of my backup questions.
Good.
For your frequently asked questions. So I love that. So to close out this episode today, give us one last take-home message to potential applicants in the future, or potential applicants during second round this year.
Sure. Our students are really happy with the program, and we know that because they come back and tell us, because they, not only in their surveys, but later, they keep in touch with us. And I know most people feel that way, but for me, I think part of it is that what I said before, the respect for each individual student. It's a family environment, and in a good way. If you're feeling like you've been with your family a little too much during COVID, but it is definitely a supportive environment where each student can thrive to her or his or their best self.
All right. Well, thank you, Kathleen, so much for
Sure.
joining me on this episode.
Thank you.
Yes. So for you, those at home that are interested in getting some more information on the program at St. Elizabeth University and to get in touch with Kathleen, I provided their website link in the description below this video. And as always, don't forget to like this video and subscribe so you never miss an episode with another awesome dietetic internship.